I am Lydia Simpson. I'm a third year PhD student based at Bangor University, looking at sympathetic activation or activation of the body's fight or flight response at high altitude. The research procedure that we were doing today, we were looking at sympathetic nerve activity or vasoconstrictor signals that are directed to the blood vessels in the skeletal muscle. And these play a really important role in regulation of blood pressure throughout the day, even when we're lying down and when we sit up. And we look at how that's regulated at rest in normoxic conditions, so when people are at sea level, and then when we take them up to high altitude. We see a really strong activation of the sympathetic nervous system at high altitude, so you get a really high activation of the body's stress response. And we have actually shown that it doesn't impact on the way we control blood pressure, so you can control blood pressure just as well at high altitude to sea level, but you need a greater activation of the sympathetic nervous system in order to counteract the widening of the blood vessels that happen at high altitude. We look at the sympathetic activation in lowlanders and high altitude natives, but we're really interested as well as what are the mechanisms that are driving this activation of the sympathetic nervous system at high altitude, and ultimately in response to hypoxia. So we've looked at whether the sensor that senses oxygen levels, or the main peripheral oxygen sensor, is important, or also the pressure within the pulmonary circulation. And this could potentially also translate to clinical populations, so a lot of clinical populations are hypoxic on a day-to-day basis at sea level, and there's probably a lot of overlap between the mechanisms that are driving this sympathetic activation in these populations, as well as when healthy people go to altitude.